Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
One of the more alarming impacts of the COVID-19 pandemic was the rate in which antidepressants were prescribed. And certainly we know that because of COVID restrictions and social isolation and all of these different factors, that mood health for many Americans took a big hit. But to see the exponential rate in which antidepressants and anxiolytics were prescribed in this country, it was incredibly alarming. And it's still going on to this day. And seeing like rates going up 20, 30% from one year to the next in terms of new prescriptions being filled. And they're able to track all of this. Seeing that exponential growth says something about our state of mind and what we should be actually looking at. And that's what I want to talk about today. So I am Amanda Williams, MD, MPH, and a real interesting study just came out that's just reinforced what we've known for so long. And this was published in the Molecular Psychiatry Journal, talking about how omega-3 fatty acids can help to combat depression. And through the utilization of omega-3 fatty acids coming from things such as fish oil, in deriving that EPA and DHA, how that actually protected the cells within the brain from programmed cell death. And this is a very important thing to understand because due to the pandemic and the rate of heightened just unknown and insecurities that many people had, this led to greater levels of low mood and full-on depression as well as anxiety. So the reason I want to talk about this is because we certainly know that when we look at the numbers and we see how many Americans pre-pandemic were taking antidepressant, it was roughly 14% of the U.S. population over the age of 12 is on some type of an antidepressant medication. Now, what's alarming about that, as I said, it's gone up 20 to 30% just in that 1 year. So the 13% that were on it, that was pre-pandemic numbers. So now we add in an additional 20 to 30% of people who have added antidepressants into their routine. Now this is alarming because when we look at the rate in which the growth of antidepressants occurred from 1999 to say 2014, we know that that went up 64%. So we're talking in a 15-year time frame, we had a 64% increase in antidepressant use. But yet in just 1 year of the COVID-19 pandemic, we had a 25-30% increase. So what does that mean? What does that mean for the state of our health? And why is it that everyone is turning to antidepressants as opposed to maybe looking at the omega-3 fatty acids? Because people don't talk about omega-3 fatty acids. Yet there is so much research out there showing the true impact that omega-3 fatty acids have in the treatment of depression. In the Journal of Integrative Medicine Research back in 2015, they reviewed all of the scientific evidence out there that was correlating the use of omega-3s when it comes to treating major depressive disorders as well as other psychiatric disorders. The role of omega-3 fatty acids in the treatment of depression have been studied and have shown that when they give people who are depressed omega-3 fatty acids, they have significant shift in their overall mood and their behavior. Now we know globally, depression is considered to be one of the most widespread diseases, and it's very complex, and there's many moving parts to depression. So not everybody fits into the same category. When you're looking at the different symptoms, you can have anxiety, we can have feelings of just having no energy, being lethargic, being irritable, feeling guilty, difficult concentration, and just a loss of overall sense of well-being. You just don't find joy in anything that you're doing. Having problems with sleeping. Is it focus? That's a big one that sometimes people overlook. They don't recognize that depression is playing a major role into this. And then we look at omega-3 fatty acids and we say, well, what's the normal consumption of omega-3 fatty acids in a traditional standard American diet? Next to none. Which is why I talk about this often when I talk about the Mediterranean diet. Why those omega-3 fatty acids are so important. Because they're playing a critical role in maintaining the structural integrity of the neurons in the brain. And for that matter, throughout the entire body. But we also recognize that those omega-3 fatty acids can help to ease inflammation and fend off oxidative stress. Which is why we know omega-3 fatty acids are essential for our existence, and they are important for normal metabolism in the body. And when we draw the connection between cell signaling and the cell membrane, and how omega-3s have actually demonstrated that they act as an antidepressant. So we see the numbers now. We see in 15 years, between 99 and 2014, 64% increase in the number of antidepressants prescribed. So apparently we're a very low mood country. Then in just 1 year, we've added another 25-30% onto that. There's a lot of people wandering around who are fully depressed or exhibiting symptoms of depression. Now, how many of those people are trying to offset that by having a high intake of fatty fish in their diet, supplementing with omega-3 fatty acids on a regular daily basis? Not many. I mean, looking at the numbers alone, we know that when you look at the fatty acid content of the average American, if you were to do a blood sample, that the omega-3s are nearly non-existent. And seeing study after study that show that fish oil containing those powerful omega-3 fatty acids, that EPA and the DHA, work as an antidepressant and ease inflammation and have this direct effect on the cell membrane properties. It would certainly make a lot of sense that we would be utilizing omega-3s. In the Translational Psychiatry Journal, they get into detail on the efficacy of using omega-3 fatty acids in depression. So they did a meta-analysis, and what they found from pooling 26 different clinical trials, they were able to show that taking just 1 gram, 1,000 milligrams of omega-3 fatty acids every day has a beneficial effect on those who are depressed. And they said supplementation with omega-3 fatty acids with people who have depression, people who have inflammation, should be utilizing this as part of their treatment. And there is growing evidence that omega-3 supplementation, fish oil, is effective in improving mood health for those who are dealing with anxiety and low mood, severe depression. So I wanted to bring this to your attention today because I do think that it's very relevant. We've known about it for a very long time, the role that omega-3 fatty acids have in maintaining the health of our brain. And if we are lacking in those nutrients, the problems that can actually cause. So if you're not taking your omega-3s every day, this may be something that you want to consider incorporating in. Perhaps you have a friend or a family member who suffers from low mood, feeling on edge all the time. And you know that their diet isn't really the best and they're probably not eating salmon on a regular basis or having seeds and nuts where they would potentially get that exposure to normal dietary intake of omega-3 fatty acids. It would be advantageous to point out to them, hey, maybe supplementing with about a gram a day, 1,000 milligrams a day of omega-3 fatty acids could make a huge difference in how you feel and your overall sense of well-being. It's a very, very easy fix. And this is something where the science is out there. And it's not something that just came out in the last week. The science on omega-3 fatty acids and mood health and depression have been around for a very long time and continuously have been shown to be effective for those who are dealing with the whole variety of symptoms that come along with depression. So that is all that I have for you for today. I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Now, do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health, and we will see you next time for another episode of the Invite Health podcast.